you again for the opportunity to provide an update during the board meeting. Just want to take some time and talk about where we've been and where we're going. Where we stand now, to be honest with you, we have more than 900 positive cases of COVID-19 in Wake County. And it sounds like a lot, and it is. But for a county of our size, the largest county in North Carolina, it could be a lot worse. And the reason we're not seeing cases in the thousands is because our residents respected and followed the stay-at-home order. And now they're doing the same for the governor's stay-at-home order. You know, it's not easy and it's not fun, but it's necessary. And I want to personally thank all of our residents for doing this. Because of our residents, we're faring better than other counties our size in the country. A few weeks ago, prior to issuing our stay-at-home order, we changed our COVID-19 response strategy from containment to mitigation because we had community spread of the virus. We remain in the mitigation phase today. With mitigation, testing and contact tracing are more focused on outbreaks among at-risk populations, like residents of nursing homes and prisons, than in the broad-based containment approach we executed early in the outbreak. Some of the steps we've taken during this mitigation phase include issuing our initial stay-at-home order on March 26, working with hospitals to suspend elective surgeries, increase ICU capacity, and prepare for a potential surge of COVID-19 cases, increasing capacity among private healthcare providers and private labs to test for the virus. Lorena mentioned this earlier, decompressing shelters for those experiencing homelessness, and conducting testing at congregate care sites. Our mitigation efforts have helped successfully slow the spread of the virus and allowed us to care for all of those who are seriously ill. I realize it's easy to say our collective efforts have been successful, and that's why I want to show you how we know that's really the case. The proof is in the data. Our hospitalization rates have been stable. You haven't seen a huge spike in the number of patients with the virus that we saw in places like New York, feared we would see here. And through smart planning, hospitals have been able to handle their COVID-19 caseloads without having to call in extra staff and bring in additional equipment. Another data point shows our success in slowing the spread of the virus is our daily rate of positive cases. If you look on the graph, you'll see a few spikes, and those align with outbreaks of COVID-19 that we've seen in several long-term care facilities and the women's prison. Even with these outbreaks, we've kept the curve below our healthcare capacity threshold. The final data point I want to show you today is our doubling rate. It's consistently lengthened over the past 2 months. And as you can see, in early March, the number of COVID-19 cases doubled every 3 to 4 days. But after we put restrictions in place, the rate lengthened and is now more than 18 days. That's a big shift, and I'm proud of how hard we've all worked to achieve that goal. Together, we've slowed the spread of the virus. That has enabled us to let our stay-at-home order expire and instead follow the governor's stay-at-home order. Governor Cooper has very clearly laid out a 3-phase plan for reopening North Carolina. The first phase would allow residents to leave home to shop at any stores that are open, not just for essentials. It would also enable parks to reopen, but the limitations on gathering of more than 10 people and the restrictions on nursing homes and long-term care facilities would remain in effect. The second phase of reopening would take place at least 2 to 3 weeks after phase 1, and it would lift the stay-at-home order while strongly urging at-risk populations to continue staying at home. It would also allow bars and restaurants and fitness centers to open on a limited basis, let places of worship open at a reduced capacity, and reopen playgrounds. The restrictions would remain in place with nursing homes and long-term care facilities. The third phase would occur at least 4 to 6 weeks after phase 2. It would allow for increased capacity at restaurants, bars, religious centers, and entertainment venues, and further increase the size of gatherings. Nursing homes and long-term care facilities would still be subject to restrictions. We understand that residents want to move through these phases as quickly as possible so we can get back to some kind of normal. But these are tough times that we're facing. And in the interest of public health and safety, the governor will base the shift from phase to phase on the data. There are 4 sets of criteria that the state will use to make the these important decisions in the days and weeks ahead. And it will measure them in 14-day periods. They are a trajectory of cases with COVID-like symptoms, positive COVID-19 cases confirmed each day by a lab, the percentage of tests that were positive out of all tests administered, and the hospitalizations of COVID-19 positive patients. In each of these four areas, the state will not move from one phase to the next until it sees a 14-day downward trend or a sustained leveling off. The data the state will use in these measures represents a statewide picture. And I'm sure the first question folks will want to know is, when will the state shift to phase one? And at this point, the answer is, we just don't know. We're waiting on concrete guidance from the governor and his COVID-19 team. Mentioned during this press conference today that the shift to phase one could happen as early as this weekend, but that's not set in stone yet. And while the state is monitoring those four data points across all 100 counties, we'll be monitoring the same measures for Wake County. This way we can detect any upward trends in our community, which would inform any corrective actions we may want to consider. And just to remember, we can always add more restrictions than the state. We just can't be less restricted. Again, we use data to guide our decision-making process, so we can do what's in the best interest of our 1.1 million residents. The first chart I want to show you is the trajectory of cases in Wake County with COVID-like symptoms. Obviously, we'd like to see it continuing to trend downward, as it has been from April 16th through the 30th, or at least leveling off for a long period of time. The second graph I want to share is the trajectory of positive COVID-19 cases each day in Wake County that are confirmed by a lab or labs. From April 16th through the 30th, you can see the yellow line is ascending. Essentially, we're going to flip that and see that trend decreasing over a 14-day window, or leveling out substantially. Same goes for criteria number 3. Out of all the tests given for the virus, we're looking at the percentage that were positive. From April 16th through the 30th, the percentage has risen steadily in the county, and we want that trend to reverse. We'd like to see the yellow line track downwards. Criteria number 4 looks at the number of hospitalizations of COVID-19 positive patients in Wake County. Our trajectory from April 16th through April 30th shows a steady flat trend. We'd like for that to continue, even more preferable, decrease. It's important to remember that we use all of these indicators to give us a fuller picture of the COVID-19 situation here in Wake County. But we also supplement these critical data points with additional information from outside sources to further inform the decisions we make. For example, our Emergency Operations Center is also monitoring a social distancing index provided by the Maryland Transportation Institute, EMS clinical impression data of flu-like illnesses, and emergency calls coming into our 911 call center associated with the pandemic. As we watch all those indicators, we can adjust the restrictions in place if we see big jumps in the wrong direction to control the spread of the virus and keep our community safe. We're also working to meet several capacity requirements before we can shift from mitigation strategy back to containment. Before we can begin widespread testing, we must have the following needs met: the ability to test 3% of our population, the staff and training needed to conduct contact tracing, and a full 30-day supply of PPE. Increasing our testing capacity is important because Governor Cooper talks about when he talks about reopening North Carolina, he says it must include expanded testing for the virus. That rings true for Wake County as well. Our EOC has developed a COVID-19 testing capacity expansion plan. The EOC will work with 4 labs to achieve a recommended goal of testing more than 1,100 people per day, or 3% of our population. We'll be working with 4 labs, the North Carolina State Public Health Lab, LabCorp, and 2 contractors, Vero Diagnostics and Asper Diagnostics. Both are local here in Wake County. Each of these labs offers test kits for us to use, and they add up to 2,600 per day, a big change from the beginning when we were lucky to have more than a dozen tests a day. In addition to what the labs offer, we also have 4,000 test kits of our own, which were assembled and are holding at Asper Lab. So from a test kit and processing perspective, we are in good shape. We have the capacity we need locally to get the recommended number of tests administered and processed daily. We do not have the staff assigned to conduct those tests, but we're working on that. Before we can start widespread testing, we also have to make sure the staff is available to do the contact tracing and monitoring of residents that test positive. The EOC has developed a plan for this. It lists the facility space, equipment, and staff will need to support this expanded effort. We'll have job descriptions for the positions that will oversee contact tracing teams to make sure we fill those roles with people who have the right skills to get the job done. We're also developing a training curriculum for county employees and municipal partner volunteers who will conduct the contact tracing so they'll know exactly what to do once they step into this role. Initially, we'll train a minimum of 100 new contact tracers, but we'll have the ability to scale up from there if needed. Our county librarians will fill those first 100 contact tracing roles. With the libraries closed right now, this is an excellent use of their skills and truly appreciate their help. The other piece we must have in place before we can begin widespread testing for COVID-19 is a strong supply of PPE equipment. The EOC has worked hard since it activated in March to target purchasing a 6-month supply to prepare us for the worst case scenario. To date, we've placed orders to hit that inventory goal and shipments continue to come in. We received all of the face shields we ordered, and on Friday, 40,000 certified N95 masks came in, which is great. We are still having some problems getting isolation gowns and gloves because the demand is so high, but we continue to work with vendors in order to close that inventory gap. Despite our success with increasing our stockpiles in most areas, we still follow a strict conservation plan to ensure we don't use our supply too long. Since none of us knows how long this will last, it's prudent to be cautious and make every effort to preserve PPE that we have in case we can't get any in the future. One of the most innovative ways we're doing that is through a joint partnership with the Wake County Public School System. They're allowing us to borrow the ultraviolet light cabinets from their middle and high school science lab, where they're used to sterilize student safety goggles. We've installed them in 42 locations, mainly EMS and fire stations across the county, so our first responders can easily use them to disinfect masks. This approach will extend the life of the N95 masks by 5 additional uses. Another innovative tactic we've taken is hiring a local business to sew straps on thousands of old N95 masks we had in storage in our facility. The elastic would break when first responders tried to put them on, but with new straps, they're fully functional and ready to deploy. Not only does this bolster our stock of masks, but it also boosting the bottom line of a small Wake County business that originally thought it was going to lay off employees. Now those employees have plenty of work and a steady income, which is a true win-win. With all these pieces coming together, we'll be ready to ramp up testing to a much larger scale as we move into the phases of reopening the county. We're still learning a lot about COVID-19, but one thing we know for sure is you can't abide by a stay-at-home order if you don't have a home. We're keenly aware of the challenges our homeless community is facing during this difficult time, which is why we're taking special measures to assist them. The EOC is operating 3 hotels that serve as alternative housing sites for people who are experiencing homelessness. 1 hotel is for those who test positive for COVID-19 or are waiting results. 51 people have used it since it opened. 6 of them were positive for the virus, and only 3 are housed there today. The remaining 2 hotels are for homeless people who are not showing common symptoms associated with the virus, but have significant health issues that put them at higher risk of serious illness if they contract COVID-19. 214 people have used these sites since they opened. None of them have tested positive for the virus, and currently we have 141 people housed there. The services they are receiving include access to nursing care, telemedicine, behavioral health resources, substance use services, and case management through Wake Merit. We've also identified 3 additional sites to house high-risk population if needed. Our approach to serving this population is not only helps protect the homeless residents from COVID-19, but it also helps prevent the virus from spreading throughout the community, which is good for all. Using hotels for short-term alternative housing works well, but it's not sustainable. It's not a sustainable long-term solution. As you heard earlier today from Lorena McDowell, Director of Lorena McDowell, our Affordable Housing and Community Revitalization Department is finalizing a plan to address those. As you can tell from what I've discussed this evening, we've had a lot to talk about lately with our residents and stakeholders in the meeting. And this has kept our communications department and everyone busy. Just like we use data to measure the success of our COVID-19 response, we use it to measure the effectiveness of our efforts to inform the public. Since the beginning of March, our communications team has sent out 61 news releases about COVID-19, which is roughly twice of what would go out normally. Those news releases have resulted in more than 1,900 stories in local, state, and national media outlets, ranging from WRAL and the NNO to Nightline, the New York Times, and the Huffington Post. Those stories reached roughly 17.7 million people and had a combined paid media value of 1.23 million. In order to write those stories, reporters asked questions, requested interviews, which our communications team handled. In March and April, they responded to more than 200 media inquiries related to COVID-19. Also, the county's main social media channels grew at historic gains in followership and engagement over the past 2 weeks. On Twitter, they sent 740 tweets, added nearly 4,000 new followers, garnered nearly 3.7 million impressions. On Facebook, they posted 171 messages, added nearly 4,700 new followers, and reached almost 1 million people. They also used a video to reach our residents in March and April. Nearly 34,000 people viewed our census profile videos and the Storytime Anytime videos, which offer the library's popular Storytime program to children and their parents digitally. This week, Human Services Director Regina Pettaway are shooting a video targeting faith-based communities to help them prepare for the eventual easing of restrictions, so when the time comes to open their doors again, they'll be ready. Our website alone in March garnered 1.9 million page views, which is a 34% increase over the previous month. Our COVID-19 page, as you could expect, is the most popular page on the site, and we're continuing to use all channels to get our messages out. But we recognize there are some things that we can do better. To enhance our communication strategy, we're preparing to launch a multilingual public outreach effort to ensure our non-English speaking residents and minority communities are informed about our COVID-19 response. Right now, we've translated our COVID-19 website into 10 of the most commonly spoken languages in Wake County, which include Spanish, Hindi, and Vietnamese. They're also in the process of creating a toolkit to provide to organizations in those communities. It'll include a fact sheet, graphics, and other resources translated into native languages so they can easily share the information in newsletters, on their websites, and social media. As part of this plan, our communications team will also do paid advertising with CASA and the Carolinian to make sure our message gets out to those who may not subscribe to some of the mainstream media. Overall, we feel like it'll be an effective and efficient way to empower those communities to share important health and safety information about COVID-19. In conclusion, our response to the pandemic is deep and wide. Today marks day 62 of the EOC activation. We don't know how many days we have ahead of us, but what we do know is we will continue to work hard to put Wake County in the best position possible to respond to this crisis. We're developing good metrics to help us monitor the situation and make the best decisions for the county. We're adapting the constant changes that come with the virus, responding to outbreaks accordingly, and planning ahead for a phased reopening. And we're committed to continuing to communicate with our residents, stakeholders, and the media, as well as the board. Because of the dedication of Team Wake and our partners, we will get through this together, and we will be better for it. Thank you for the time this evening.